like to invite Caleb Egwuenu, U.Basu Roy, and Brendan Stiles to the stage to talk about the IASLC STARS program. While they're pulling up slides, Caleb is our winner, Upal is the mentor, and Brendan is a thoracic surgeon.
First of all, I want to thank the IASLC for starting this pioneering program, the STARS program. And I have the honor of being one of the mentors for the program. And you'll hear from one of the mentees, Caleb, and also from Dr. Stiles, who will talk about the physician perspective on why the STARS program is so vital for lung cancer research, and specifically research advocacy. These are our disclosures. So I think Dr. Bunn set stage for this particular slide. I think we've seen a lot of progress in lung cancer research over the past 5 to 10 years. It's completely transformed. So this is just a very basic slide, and I think everyone sitting in this audience is probably very familiar with this slide. So what we did was we just mapped the number of clinical trials that have been activated over the past 30 years, and as you can see, it has dramatically increased over the past 10 to 15 years. And now we have first-line clinical trials, which we did not have a couple of years ago. Now, this progress is amazing, but at the end of the day, what we need to be thinking is how do we make this research, this progress, patient-centric? Which is what then brings me to my next slide. We, as a community, really need to bring back patient in patient-centered care. Now, what I have here is an infographic from UPATI, which is the European Patient Academy. I thought, we are in Barcelona, so, we have to thank all the work that our European colleagues have done in patient advocacy. Now, what you see is a very systematic approach to patient advocacy. And what you have below the blue box, that's traditionally what you've thought of patient advocacy, where you don't need to have a lot of experience in the science. And I think usually we think of patient advocacy as raising funding for research, but the goal of the STARS program is to sort of move patient advocates to the top category where they're actually able to participate in the research aspect of advocacy, where they have the training to sort of give the patient voice to actually making sure that study designs are patient-centric, research is meaningful to the patient community. So with that in mind, the STARS program was developed, and it was developed with the help of patients, and it's the supportive training for advocates in research and science. Now, what I have here is essentially the goals of the STARS program. First of all, to create a network, to create a community of research advocates. Now, I need to distinguish research advocates from patient advocacy, because these are advocates who are much more advanced in their advocacy journey and now want to learn the science of lung cancer, the research of lung cancer, which is essentially a second piece of the STARS program, educate patient research advocates about the science and research. And the communication piece, this is incredibly important for all research advocacy, how to communicate science. And the second piece of that is how to understand research. When we come to IASLC, when you see a presentation, what does that presentation really mean? Is it a good presentation? Is the science presented strong? What does that mean for the lung cancer community? And then, of course, I think the ultimate goal is to help patient research advocates identify research advocacy opportunities in their own countries. For example, being part of a grant review process, being part of a protocol review process. And with that, it is my privilege to introduce the 5 PRAs who were selected as the STARS advocates for this year. And this was a very, very competitive selection process, and 5 of them, as you can see, are from different countries, and 5 of them were selected from 35 applications that the STARS program committee received this year. And today you'll hear from one of the STARS program, one of the patient research advocates, Caleb from Nigeria. And with that, I'll turn it over to Dr. Stiles.
Great, thank you very much. My job's actually pretty easy. I'm really just going to echo Dr. Bunn. I think I was born in 1972 in Virginia when you had that first planning meeting, so I'll take that as a good sign. But I think for people hearing little bits and pieces of the press conferences in one little presentation, trying to put that into the big picture of what it means in lung cancer is sometimes hard. But echoing Dr. Bunn, the thing to really think about and grasp for the press over the course of this is the incredible progress that we've made in lung cancer. I give a talk to the medical students each year about lung cancer, and I look back at my 2013 talk, and the algorithm under stage 4 was chemotherapy, consider targeted therapy, that I had pulled out of a journal. And really there was nothing to talk about in stage 4. Where we are now, this is the treatment algorithm that was put out by a guy named Jordi Riemann, who's actually here in Barcelona, about the treatment paradigm in 2019. And look at all the different pathways where a stage 4 lung cancer patient could go. I'm not going to begin to try to describe that, nor does the press need to wrap their head around that. But wrap your head around the idea of going for chemotherapy, maybe targeted therapy, to all these multiple pathways in cancer. And that's really what the IASLC is about. It's really what all these talks and presentations over the next couple of days will be about. And then the challenge for us and for STARS, though, is really telling this story through the patients and through the advocates like Caleb. How do we give them the language to talk about it? How do we go home and tell those stories to people to get them interested in the story of lung cancer and to understand the incredible science and the progress that's been made there? Patients have so many research touch points that it's critical that they understand and talk about it along the way as they go, and that's clinical trials. It's asking to give your tumor or give your blood for biobanking, joining advocacy groups, even participating in research funding panels. Every panel that I've been a part of that's had a patient or an advocate there as part of the decision-making process has been a better panel. And then it's meeting participation for meetings like these, but then really taking the story back home to your local cancer centers is really what we want to empower these patients and these advocates to do. And I truly believe that at every step of the way, patient participation and knowledge improves the process. It allows them to have ownership of the journey and to really be a part in the decision-making. I say it probably improves outcomes. I think all of us here know that it does, but we challenge the patients to take this data critically. We don't have a critical clinical trial that shows it improves it, but I know it does, and I know that they do. And importantly, it's going to help future patients. And then finally, telling the story through the patients, I think, will really allow the community to lobby for more research support for lung cancer, to bring it up to the level of funding for other cancers. And so with that, I'll introduce the real star of the show, Caleb.
Thank you very much. Before last year, I was a patient advocate, but for other forms of cancer, breast, cervical, and prostate cancer. And before then, I never knew that there was anything to do in terms of advocacy in lung cancer, because I felt, myself, like if you stop smoking, you wouldn't get lung cancer, so there's no need, for advocacy. But something happened last year when someone very close and dear to me, less than 30 years, never smoked in his life, passed on in just quick succession of 2 months of diagnosis. And that took me down a path that's brought me to become a patient advocate in lung cancer. This STAR program was created so that we could know more about the science of lung cancer. Last year was equally the first time I heard the word radon, and that it causes lung cancer. I've never heard about it, so I feel that this STARS program is something that is good, that would expose the patient advocates to learn more about the science in lung cancer. It will make, what the program would do, it will make us understand more about lung cancer and how to, during the course before coming for this program, that's before the conference, we had a series of webinars and conference calls. And they were taught how to interpret results. So before, if I go, to a conference and they're saying lots about the data and things, I was, be lost. But now with the program, I understand, when there's the p-value and things, in the presentation, and equally to understand more about research advocacy, like. For clinical trials, one of my interests, is in clinical trials, and there was a presentation that was shown to us today, and in clinical trials for Africa, there were just 9 clinical trials in Africa, whereas in the US, I think it was over 600 or so, and in India, it was just 15. So I think that this program would actually help us to drive more in terms of clinical trials, not just in the Western world, but in the developing world. And one thing about this society is that this society is truly global. not just focusing on the Western world, but they really want to reach globally. And what this program will help do is that it will help me to raise other advocates, because I'm a mentee now. In the next 1 or 2 years, I'll become a mentor. So I would actually be able to mentor other advocates in Africa, and actually, by the grace of God, maybe when we are back here in 1 or 2 years' time, the numbers will increase from 9 to maybe 15 or more than that. So thank you very much.
Thank you, gentlemen. I'd like to invite Matt Smith